Scarlet here from Wave Plastic Surgery. Today I'm going to go in depth on which areas I get filler and Botox done, why I treat those certain areas, and also why Botox is not a one-size-fits-all treatment. So these are units and areas that I like to get done personally, but everyone is different and everyone needs different units based on how strong their muscles are or whether they want a more natural look or if they want to look more frozen. So it's good to come in for a consult to see what's perfect for you. So why do I get injectables? I want to make sure that I age gracefully and look young forever. So we'll first start off with where I get fillers done. I actually get chin filler so that I have more projection in my side profile, and also it lengthens my face a little bit. And then I also get some Sculptra in my cheeks where I have like a little bit of these lines over here. So basically in my mid cheek to help volumize this area. So the exact areas I get are literally this little line right here for my cheeks. I could probably do a little bit more this year. And then for my chin, I just do literally one injection point over here to help lengthen and project it. For Sculptra, I do one vial split amongst both sides. And then for filler, I do like a high G prime filler, just one syringe on my chin. A lot of my patients actually really like doing these two areas because putting some filler or Sculptra in the mid cheek helps volumize this area, and it actually helps lift the nasolabial folds a little bit and makes your under eyes less droopy. And then putting filler in your chin helps lengthen your face and makes you have an overall slimmer looking V-line shape. I personally like doing Sculptra on my cheeks because it's more natural. My body builds collagen as time goes by, but for other people, if you have severe volume loss, then filler might be a better option for you. But personally for me, I prefer doing Sculptra on my cheeks. So for neuromodulators, I do my upper threes, so my forehead, my glabella, and my crow's feet. For my glabella, I like to frown, and then I do like a 5-point injection on myself. For my frown line, I do about 16 because I like to be really frozen there. I don't want to frown ever. So I like to hit the procerus muscle over here and then my corrugators. For my forehead, I have some Botox left over from my previous treatment, so you can't really see my muscle movement, but I like to do my arches over here and then a little bit like this. So 5 points here as well. I usually do about 12 units in my forehead. For my crow's feet, along my eyes over here, you can kind of see I have a little bit over here and a little bit down here. So I usually do only like 8 units here, and then one little dot right there to help with the line over here. So I do 8 units on each side of my crow's feet, so 16 units total for my crow's feet. And like I mentioned before, it's kind of hard to see my expressions right now because I just had Botox done about 3 months ago, so it actually lasts pretty long for me, but usually it only lasts around 3 to 4 months. For me, it lasts up to 4 months, so that's why my expressions aren't fully back yet. So for my forehead, I try not to go too low, like over here, because that's gonna drop your brow and give you like this kind of look. I also don't want to go too high for my lateral injection because then it might give me like an arch that I don't want. For my crow's feet, I try to stay up here because if I inject over here, it's gonna get rid of my jelly roll, which I actually like because I feel like it makes me look a little bit younger. So I only stop over here and don't go over here. So personally for me, I inject my own Botox because I feel like it's easy and fast, and I like how I do it. But for fillers, I would prefer if someone else did it on me, like one of my other coworkers, because it's kind of hard to manipulate the cannula, and just doing that on myself is like a little bit scary. I think a good tip in choosing the right provider is making sure that they talk to you about what your goals are and they don't just say yes to you, create like a customized treatment plan for you. someone that's not just gonna always say yes to everything you want just because, you know, it might not look good, and we wanna keep things looking as youthful and natural as possible. Once again, I wanna reiterate that this is what I get for my own face, so it's important for you to come in to see what we can personalize and customize for your own face.